Think about it for a second. How often are you popping into your local pharmacy to grab, say, a tube of toothpaste, versus actually going there for medical advice? It's kind of funny, right? But it really gets to the heart of a massive shift happening right in our own neighborhoods. Today, I want you to challenge your perception of the local pharmacy. Is it still just a convenience store, or is it secretly becoming your doctor's office?
Welcome to today's Explainer. We're going to completely unpack the hidden, honestly pretty complex world of modern drug retailers. It is a fascinating ecosystem hiding right in plain sight, and understanding it is going to completely change how you look at everyday healthcare. So here is our roadmap for today. We'll start with the modern drug retailer, check out the sustainability landscape, talk about securing personal health data, dive into supply chain and safety, look at patient health outcomes, and wrap up with measuring industry progress. Basically, we're starting with the macro business model and then zooming way in on the operational metrics.
All right, Section 1, the modern drug retailer, beyond the convenience store. Let's look at how these massive retail machines actually make their money. Take a look at this. It perfectly illustrates our core focus today. The absolute vast majority of a drug retailer's revenue is coming directly from consumer sales of prescription and over-the-counter drugs. All that other stuff, household goods, personal care items, a little bit of groceries, that just supplements the main income. So they really aren't just grocery stores that happen to sell pills. They're essentially medical distributors that just so happen to sell milk.
But here's where it gets super interesting. Because the industry is evolving, and I mean fast. Pharmacy retailers are aggressively expanding these health-focused services by operating actual clinics directly inside their various retail locations. You aren't just swinging by the drive-thru for a prescription anymore. We're talking checkups, vaccines, and direct medical consultations. It's a whole new world.
Which brings us to Section 2, the sustainability landscape managing the shift. This massive transition to becoming full-fledged healthcare providers drastically shifts the industry's entire sustainability landscape.
We are going to anchor our analysis today in this, the SASB framework. That stands for the Sustainability Accounting Standards Board, which is an industry standard. It lays out the critical metrics and disclosure topics you literally have to track to sustain this new clinic model. It's not just about measuring profits anymore. It's about ensuring operational sustainability across the board.
You gotta think of a modern pharmacy like a giant iceberg. Beneath the surface of you just grabbing a quick snack, these are intense, often 24/7 operations. They require massive energy consumption for constant lighting and commercial-grade refrigeration to keep sensitive medications safe. So under SASB standards, they have to meticulously track their energy footprint. We're talking total energy consumed in gigajoules, monitoring grid electricity usage, and tracking renewable energy. As these stores morph into clinics, their energy footprint absolutely explodes.
Moving on to Section 3, Securing Personal Health Data, the Invisible Vault. As pharmacies become health clinics, they're handling vast amounts of highly sensitive information, making data security absolutely paramount. First, we really need to define what's actually at stake here. Personal health data is a whole different ballgame compared to, say, someone stealing your credit card number. This data relates directly to your physical or mental health and the specific healthcare services you're receiving. It literally reveals your most intimate, private health status.
To protect against cyber attacks, which, let's face it, are a huge threat right now, drug retailers have to rigorously manage the entire life cycle of this information. The clock starts the exact second they collect your ID. It moves through internal use, retention, processing, disclosure, all the way to the eventual, completely secured destruction of those records. Messing up any of these 6 steps, that's not just a minor glitch, it's a colossal legal and personal liability.
So, keeping this data safe essentially requires a triple-layered defense. First up, you have administrative safeguards, your formal policies, how staff are trying to conduct themselves. Then physical safeguards, literally protecting the computer servers in the actual buildings from hazards or break-ins. And finally, technical safeguards, using advanced authentication to strictly control exactly who gets to see what. It operates as a highly complex, invisible vault.
All right, Section 4, Supply Chain and Safety, the Battle for Integrity. Let's pivot from digital risks to physical ones and look at the massive logistical machinery of the drug supply chain. One of the most absolutely critical risks here is counterfeit or compromised drugs somehow sneaking into that supply chain. Basically, counterfeit drugs are sold under a product name without proper authorization. They might be completely missing the active ingredients, or even worse, contain totally wrong ones. Obviously, this is a massive direct threat to your physical safety as a consumer.
To fight this battle, retailers have built this massive arsenal of defenses. Rigorous vendor inspections and supply chain audits act as the first line of defense. From there, they utilize incredibly complex barcode traceability, participate in industry-wide audit sharing programs, constantly upgrade their pharmacist training, and even coordinate directly with law enforcement. It's a huge effort to protect both national brands and their own growing private label products.
But, what happens when this system actually fails? Well, the magic number here is 0. 0 is the ultimate ideal goal for product safety recalls and compromised units making it to the shelf. When that number isn't 0, retailers are forced to immediately issue product safety recalls, painstakingly tracking every single unit pulled to prevent any adverse health consequences.
Section 5. Patient Health Outcomes, the final checkpoint. Because at the end of the day, pharmacies are often the very last healthcare professionals a patient interacts with before actually consuming a medication.
A super relatable metric here is what's called the first fill adherence rate. Honestly, this just tracks how often we actually remember to go pick up our prescribed medication refills after that initial visit. Pharmacies pour heavily into strategies to improve this rate, mostly because it has a direct, massive impact on our long-term health outcomes.
And just as critical as actually taking your medicine is making sure you're taking the right medicine. A dispensing error is any discrepancy between what your doctor wrote on the prescription and what the pharmacy actually hands to you. To stop these errors in their tracks, they rely heavily on process automation, barcode scanning, and super rigorous data verification to make sure you get exactly what the doctor ordered.
Finally, Section 6, Measuring Industry Progress. Accountability. How on earth do we hold these massive retail clinics accountable for all the complex moving parts we just covered?
Well, to put it simply, we follow the money. Specifically, we track monetary losses from legal proceedings. Whether it's huge fines from a data breach, settlements from dispensing errors, or regulatory penalties involving the mismanagement of controlled substances, this is where you see the real-world penalties of operational failures. Mitigating theft, loss, and illegal dispensing is absolutely vital to preventing some pretty severe public health consequences.
So, I want to leave you with this final thought. As your local pharmacy continues its transformation into a full-scale health clinic, just how secure is the data and the medicine powering your care? As these spaces evolve into our primary healthcare hubs, understanding these hidden sustainability mechanisms is definitely more vital than ever. Thank you so much for diving into this explainer with me, and stay curious.